Hi there, I'm Dr. Penny Sutcliffe and I'm the Medical Officer of Health with Public Health Sudbury and Districts. We're into 9 months now of COVID-19 and our second wave of this virus in our community. We've recently seen an increase in cases, which has pushed us over into the yellow zone. That's the yellow protect zone from the green prevent zone of the province's COVID-19 response framework. So this is important because it signals to us not only the additional restrictions in the yellow zone, but also our need to recommit to COVID prevention measures. And you know what those are: staying home when you're ill, not going to work, not going to school, having a low threshold for symptoms that mean that you stay home, wearing a mask when you go out, keeping your distance of 2 meters, getting tested if you feel ill. These are also very important. They're relatively simple for us all to do, but they are so key and fundamental. Way more important, I would say, than the additional restrictions in the yellow zone. When we look at the cases that we have seen in the last little while, many of those individuals are people in their 20s. And these are people who, when we investigate, have really appeared to have got the virus or spread the virus within private social settings and in household settings. So this is important to understand because it again points to the need for us to practice those COVID safe measures, but also to keep our close contacts to those who are under the same roof as us, those who are in our household. Very, very important to underline that for all of us. The other thing that I would share is that the cases that we have followed up on, that we have reported on, are really the tip of the iceberg. For every individual who's diagnosed with COVID-19, there are anywhere between 12 and 15 contacts, close contacts that they have had. So public health follows up on all of those individuals, which at our peak in the last while has totaled almost 500 individuals. We ask them to self-isolate and to get tested. So the good news about this hard work is that it is paying off, in that the last number of cases that we have had reported to us have been individuals who are already at home on isolation because they have been identified as a close contact of somebody who has COVID-19. So they were not able to spread the virus any further. So this means that we were able to keep COVID-19, to stop it in its tracks so that it was not spread any further in our community. But if you think about these cases and the contacts as kind of little fires of COVID-19 in our area, so bushfires, please don't rely on public health to put out all of these fires. We cannot do it alone. We will not be able to do it alone if we continue to see a rise in cases. We need you, everybody, with your decisions on a daily basis to prevent these fires from starting in the first place. So you know what that means. Please think about that the next time you're thinking of getting together with somebody outside of your household. The other thing I think about in terms of getting together with people outside of our household is the fact that the holidays are coming and the holiday preparations are upon us. So this could mean shopping, getting together with people that we might normally do. Think twice before you go out. Think twice before you invite anybody over, and really do your best to keep to people in your household, or to make sure that if you are getting together that you do so in a COVID safe manner. On an optimistic note, I am feeling very positive about a vaccine for COVID-19 in 2021, and Public Health Sudbury and Districts is working behind the scenes to make sure that we are as ready as we possibly can once we hear about a vaccine, that we're able to get it in our community and into your arms. So thank you very, very much. Keep up the good work, recommit. Let's pull up our socks, Sudbury and Districts, and make sure that we're doing all we possibly can to further prevent the spread of COVID-19. Thank you.